Hello, my name is Megan Surrey, and I'm an adult nurse practitioner practicing at the T-Mobile On-Site Health Center in Overland Park, Kansas. Today I will be talking about hypertension, otherwise known as high blood pressure. Hypertension is so much more than just a number. Let's explore some information on this topic together. Everyone has likely heard the term hypertension, but what really is hypertension? Hypertension is a term that describes high blood pressure. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of the body. It is normal for your blood pressure to rise and fall throughout the day. The only way to know your blood pressure is to take a reading or measurement of it. When you go to a medical visit, we all typically get our blood pressure taken. The result is made up of two numbers. The top number is known as the systolic pressure, and this is when your heart beats. The bottom number is known as the diastolic pressure, and this is when your heart relaxes. In the picture, the blood pressure reading is 120 over 75. 120 is the systolic pressure, and 75 is the diastolic pressure. But why should we care? Elevated blood pressure can affect our whole body. Hypertension remains the leading cause of death globally. It is often called the silent killer and often has no symptoms. If left untreated, this can cause concerns throughout your whole body. High blood pressure can damage our arteries and vessels, which can lead to heart attack, stroke, heart failure, kidney disease, kidney failure, vision loss, sexual dysfunction, among other issues. Most people don't have symptoms from high blood pressure until it has caused serious health problems. About 1 in 3 U.S. adults with high blood pressure aren't even aware they have it and are not being treated for their high blood pressure. It is important to monitor your blood pressure and have your blood pressure checked at least once a year. So how do we diagnose hypertension? Your healthcare team can diagnose high blood pressure and make treatment decisions by reviewing your systolic and diastolic blood pressure levels and comparing them to levels found in certain guidelines. The guidelines used to diagnose high blood pressure may differ slightly from healthcare professional to healthcare professional. Some healthcare professionals diagnose patients with high blood pressure if their blood pressure is consistently 140 over 90. Other healthcare professionals diagnose patients with high blood pressure if their blood pressure is consistently 130 over 80 or higher. Although these guidelines differ as to what number is truly considered hypertension, they both agree a normal reading is less than 120 over 80. So with less than 120 over 80 as our goal, let's talk about checking your blood pressure. A great way to check your blood pressure is by performing home blood pressure readings. There are some great pointers that will help ensure that you get the most accurate blood pressure reading. A few of these are: do not exercise, drink coffee, or smoke cigarettes for about 30 minutes before your test. Try to go to the bathroom before your test. Sit in a chair, relax for at least 5 minutes before the test with your feet flat on a floor. Do not talk while you are relaxing or during your test. It is best to place the cuff on your bare skin and rest your arm on a table so that it is supported at the level of your heart. It also helps to be in a quiet room with a comfortable temperature as well. Using the cuff that is too small will result in an artificially elevated blood pressure, and using a cuff that is too large will result in an artificially low reading. Follow the guidelines that come with your home blood pressure cuff to ensure that you have the correct sizing. What puts us at risk for hypertension? Many factors raise your risk of high blood pressure. Some risk factors, such as unhealthy lifestyle habits, can be changed. Other risk factors, such as age, family history, genetics, race, ethnicity, and sex, cannot be changed. A healthy lifestyle can lower your risk for developing high blood pressure. Included in the chart are a few risk factors for hypertension. Your risk factor increases with advancing age. Your risk increases if you have a relative with hypertension. Your lifestyle is important as well. Consuming a large amount of sodium in your diet, drinking large amounts of caffeine or alcohol, sedentary lifestyle, not getting enough sleep, smoking, and using illegal drugs all increase your risk. A BMI greater than 30 increases your risk of hypertension. And some medications can affect your blood pressure as well, such as decongestants, anti-inflammatories, and birth control can all raise blood pressure. So what can we do to help? Let's talk about lifestyle interventions. Lifestyle interventions are things we can do that make a big difference. Try incorporating regular exercise, weight loss, salt reduction, adding in healthy diet and drinks, lowering alcohol intake, reducing stress, and inducing mindfulness. You could also consider the DASH diet. The DASH diet is a dietary approach to stop hypertension. It's an eating plan designed to help you manage blood pressure. Its emphasis is healthy food sources. It also limits red meat, sodium, sweets, added sugar, and sugar-containing beverages. What if I have hypertension? There are some important things to do if you think you may have hypertension. First, meet with your provider. See what changes you can make on a day-to-day basis. Exercise, diet, weight loss really goes a long way. You can check your blood pressure readings at home and compare those blood pressure readings to the blood pressure readings in the office. Depending on what your blood pressure reading is, it may be recommended that you make lifestyle changes, or at times medications may be recommended. It's important to get motivated and make a plan. And most importantly, make sure you follow up, return for your blood pressure readings and checkups, keep up with your annual physical, and determine if your blood pressure may need closer monitoring. As one of the nurse practitioners at the T-Mobile Health Center, hypertension is a diagnosis that I see on a daily basis. We would love to help you on your journey to better health. Please reach out to us with any questions or concerns. Our information is listed on the screen, and our nurses and provider would love to help in any way we can. Thank you so much for taking the time to listen today.